My name is Richard Nayan, and I'm the lead epidemiologist for the National Center for Complementary and Integrative Health, also known as NCCIH, at the National Institutes of Health. Two of my co-authors and I are going to tell you about our recent review article titled Evidence-Based Evaluation of Complementary Health Approaches for Pain Management in the United States. The review will appear in an upcoming issue of Mayo Clinic Proceedings as part of the Symposium on Pain Management. I'll briefly describe the background of the review. Dr. Partap Khalsa, Deputy Director of the Division of Extramural Research at NCCIH, will discuss our major findings as well as limitations of the study. Finally, Dr. Wendy Weber, who leads NCCIH's Clinical Research Program in the Division of Extramural Research, will discuss what the findings mean for healthcare providers and for patients. We know that while most pain is acute and improves with a short time, millions of Americans suffer from more persistent pain that may become chronic and debilitating over time. Medications may not completely relieve chronic pain or can produce unwanted side effects, including addiction. As a result, many people may turn to complementary health approaches to help manage their pain. Our goal was to summarize the evidence base on what is safe and effective when it comes to complementary approaches for pain. We reviewed the clinical trial evidence base for popular complementary approaches used in the treatment of some of the most common pain conditions in America: back pain, osteoarthritis, neck pain, and severe headaches or migraines. These are all pain conditions that would be treated in a primary care setting. We also reviewed the data on fibromyalgia. While this condition is not as common as the other conditions in the review, individuals with fibromyalgia frequently use a variety of complementary approaches. For each painful condition, we reviewed data on the safety and effectiveness of several complementary approaches, specifically acupuncture, spinal manipulation, massage therapy, relaxation techniques including meditation, certain natural product supplements, Tai Chi, and yoga. As part of the review, we identified 105 randomized controlled trials published between 1966 and 2016 that met our inclusion criteria and were relevant to pain patients in the United States.
The data suggests that some complementary approaches may help some patients manage, though not cure, painful health conditions. This includes yoga and acupuncture for back pain, acupuncture and Tai Chi for osteoarthritis pain of the knee, massage therapy for neck pain, and relaxation techniques for severe headaches and migraine. Although the evidence was weaker, the data indicate that massage therapy, spinal manipulation, and osteopathic manual therapy may provide some help to people with back pain. Relaxation approaches and Tai Chi may help those with fibromyalgia. A few methodological limitations about our review are important to mention. The clinical trial participants were predominantly white adult females. It's not clear whether these findings can be generalized to the diverse U.S. population. We restricted our review to clinical trials performed in the U.S., which is both a strength and a limitation. The strength is that the included studies represent how these complementary approaches are actually used in the U.S. and may be most meaningful to primary care physicians in the U.S. Because there are sometimes major differences in how complementary health approaches are licensed and regulated in other countries, the findings from other countries may not be directly comparable to how these approaches are practiced in the U.S. However, by limiting our review to studies conducted only in U.S. populations, we based our conclusions on a smaller evidence base than if we had included trials conducted regardless of country of origin. Some of the included trials had modest sample size with less than 100 participants. Various outcome measures were used across different trials, and most complementary approaches can be and often are administered or practiced in slightly different ways, which makes it challenging to strictly compare study to study. However, despite all of the differences in the ways the clinical trials were conducted, none of them reported serious adverse events, which is consistent with the findings of other systematic reviews of complementary health approaches. That is, they generally appear to be safe.
A major goal for this study was to be as relevant as possible to primary care providers in the United States. who frequently see and care for patients with painful conditions. According to a 2011 report from the Institute of Medicine, pain is routinely undertreated in healthcare delivery, and pain treatment is often provided in a fragmented way without a comprehensive management plan. And providers face challenges in advising and educating patients about complementary health approaches. In order to improve care, providers need more high-quality information on the evidence base for various pain management tools, especially non-drug approaches. Our review included complementary approaches compared to usual care, so it should help providers identify which pain symptoms might respond when a complementary approach is added to current standard treatment. We know that patients may have difficulty obtaining the full range of potential pain treatments, and that pain is the #1 reason people turn to complementary health approaches. These findings indicate that some of these approaches may hold promise in treating painful conditions and are generally safe. For some patients, the use of complementary health approaches may enable them to better manage their pain and/or reduce their need for pain medications. The data support discussion between caregivers and patients to consider mind and body therapies to reduce pain and enhance functioning in patients with osteoarthritis of the knee, low back pain, neck pain, and severe headaches and migraines.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.